The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare. You are eligible if you are age 60 plus or if you're an adult with certain disabilities. Medicare is your health insurance provider if you so choose. We'll talk about what it's all about. What does it cover? How does it cover it? How you enroll? And we'll be talking about some helping programs. Great information. Stay tuned.
Flight 109. Is that Evel Knievel on the runway?
Whoa, Daredevil. You need a Montana Real ID to fly. Go to mtrealid.gov to make an appointment.
Looks easier than jumping a canyon.
Smile. I see you changed your name from Robert to Evel. Did you bring your name change documentation?
I'm not trying to pull a stunt. Got the paperwork right there.
Go to mtrealid.gov.
Now I can fly. It's that easy.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
Welcome to Aging Horizons. I'm your host, Brian Lamore, and we're brought to you by the Department of Public Health and Human Services. As I mentioned, we'll be talking about the basics of Medicare. Who's eligible? What is Medicare? We'll have some helping programs, and we have resources to help you with the program. Sign up or any problems that you might have or questions. We'll have a telephone number for that. Joining us is Kimmy Everman. You're the Communications and Outreach Specialist of Senior Long-Term Care Division, and you do a lot with Medicare.
I do.
Welcome to the show, your show.
Thank you.
And let's start at the top. You know, there's A, B, C's, and D's of Medicare. Tell us what those are about and how they benefit the individual.
Okay, so let's first, if we can, begin with the fact that once you're 65, even though a lot of us, like myself, has a higher retirement age, at 65, I'm eligible for Medicare. So anybody that is 65 and older will be eligible. As you said in the open, if you're an adult with a disability, you may be eligible as well prior to 65. So I guess I want to make sure that folks know that although there's that age, there may be a reason for you to get it earlier than 65.
Yeah.
The other side of that, Brian, is, you know, we have many folks that are working past 65 and have health insurance from their employer.
Right.
If that is a position that a person is in, they can call and talk to a SHIP counselor and find out how to, put off the Medicare for a little while without getting a penalty.
Right, yes.
So that first piece is really, really important. We want folks to know that. And I'm going to start right away with a plug for the SHIP counselors. You know, we've said so many times on this show what what a wonderful group of individuals these people are, and that has not changed. I mean, I think I like them better.
Yes.
And all you have to do is call the area agency in your area, and we'll put that number on the screen, and talk to a SHIP counselor, and they'll answer any questions that you have. Right. No dumb questions, number one, and number two, if they don't know, they'll find out for you.
Right.
So the ABCs are like this, Brian. Part A of Medicare is hospitalization, major medical. Part B is outpatient. Part D, as in dog or drug, is drugs. And then there's a Part C, which is the others, all mixed together in one plan, and sold by a private company. So Part A, the hospitalization, very important for folks to have that major medical. And you're going to get that at no premium if you've got enough work credits in. Work credits are 40 work credits, and for most people, that's just 10 years of full-time work.
Right.
So easy to get to that usually. But if you have less quarters, you can also still get Medicare. You just may pay a different premium, yes, than other people. Again, something a SHIP counselor can help you get through, because that would really be a maze.
Right.
So that's Part A. Part B is your outpatient, and really very broad services under that. Go to the doctor, get lab work, that kind of thing. Part D, which we just mentioned a minute ago, is the newest piece of Medicare, and actually it's about 15 years old now, but it covers drugs, prescription drugs for people. And, I just want to say that the history that Medicare beneficiaries for a very, very long time didn't have this. And so it's a really happy thing that this now exists. We're so happy that it's available. So drug plan in 2021 in Montana, the average is $30 a month. But we have lots to choose from. And again, you go talk to a SHIP counselor.
Yeah.
Okay.
Sure.
And then Part C, which is, as I said, a mixture of A, B, and D. And you may be buying that from a private insurance company. You're still a Medicare beneficiary. That does not change. But all your services are going to come together in one big group, as opposed to sort of individually, as I was explaining before.
Right, and the Part D, there are a number of different options under there, and that is to be customized to your particular needs, right?
Absolutely, yes.
Yeah,
absolutely.
And how often are we able to maybe review our Medicare plan if we? The things that we've chosen, particularly with the Part C, and we can reevaluate whether it's meeting our needs or to change a plan.
Right. Well, we have open enrollment every year from October 15th to December 7th, which is Pearl Harbor Day. Yeah. But that doesn't mean that if you get into a situation where it does not work for you, that you can't change it. And that's, again, when you call one of those SHIP counselors. The good thing is that although Medicare has been very strict about certain things over the years, they're starting to see that individuals may have difficulties. And so we have some mechanisms to help individuals who may have a plan that just doesn't work outside the enrollment period.
Because everything isn't black and white.
Exactly.
We have to adapt it.
Right.
And what's particularly important is our SHIP counselors, in that they're aware of all the different ins and outs of Medicare, and they're there to help you. Now, they won't choose plans for you, but they can help you point out plans that might be advantageous to you. And what's important is they don't have anything to sell off the shelf. They're independent, they are confidential, they're not going to be talking to anybody, and they're in your community. Now, we have a lot more great information. Stay tuned, we'll be right back.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. at least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about Medicare. We're about 9 months into the 2021 Medicare season, and you've probably participated in some health care and providers. So you've had some costs, maybe you've not had some costs. It might be a good time right now to evaluate how the plan is that you have chosen is best serving you. And Kimmy, what are some of the markers we might want to think about to say, I like this or I'd like to change something?
Right. Yeah, because I think it's important for everyone to remember that you get choices in Medicare, and you get to decide what works the best for you. Some of those markers that you mentioned would be things like add up your out-of-pocket cost for the last 9 months. Is that what you expected? Is it an enormous amount that you're shocked at, or is it? Did you feel like you knew that was what it was going to be? Right. And I guess let me back up just one step and say this is really all based on doing your homework. Yeah. And for folks, when they're picking these plans, it's so important to do the homework. You can do it yourself. You can go to Medicare.gov and do some research on the plans. You can call a SHIP counselor who will help you figure out what to do next. But it's just imperative that you have that amount of knowledge, because you're going to probably be in this a year. Yeah. And you want to make sure that it fits for you. Another, besides out-of-pocket costs, another is customer service. You know, if you have issues with a bill, do they treat you right? Right. Do they help you get that resolved? Because as a Medicare beneficiary, you know, that company is getting supported by Medicare, and it's their job to treat you right.
Yes.
And to give you the information that you need. Another way to evaluate plans is, does it cover the doctor that you want to see? Some plans do. But there's many plans that maybe the doctor, like in some of the Medicare Advantage plans, maybe the doctor doesn't work in that network. Yeah. And, you know, or not even just a doctor specifically, just the healthcare facilities that you need to go to get your services. Is it close or far? Is the parking okay? I mean,
yeah,
you know, think about, when I think about folks who have disabilities and there's 1 or 2 parking spots for those folks, that just isn't good enough. We need more because there's more people that have those disabilities
Yes.
who don't want to walk in from the back 40, as I call it.
Right.
So, really, the looking at your plan, you need to take into consideration what's the most important to you.
Mm-hmm.
And then check the boxes and see if that plan has made you happy, has covered you well, the financial part is always very, very important.
Mm-hmm.
Is it well priced?
Yes, yes. And, Medicare has a group that we call Well Health, and that is to basically monitor your health systems during the year, which, to generalize, are free, but you need to participate in them. And what are those wellness programs?
Brian, you couldn't be more right. You have to take the step to participate. So what you're referring to is, first of all, the Welcome to Medicare visit, which you take advantage of in the first 6 months that you are enrolled in Medicare. And it's extremely, extremely good information. What you need to know, though, is that Welcome to Medicare visit is going to mostly be building a baseline of your health, wellness, illnesses you might suffer from, your family history, to your nutrition, to your exercise. Are you vaccinated? Just all of those things. That visit is going to set that basis so that as you go forward with that provider, there's something you can refer back to that will help you get better care.
They note the changes you're going through as you age.
Exactly. And then there, in conjunction with that is that there's also the ability to have an annual sort of checkup or wellness check. Again, at no cost for the most part. You can look into it with your provider, but that again helps build that baseline and keeps your providers aware of changes, aware of things that are staying the same, aware of what you want for your health.
Right. And Kimmy, we're kind of jumping around on topics here, but insulin has become a big topic, and there's been some changes. You're the person that knows. Tell us about the insulin changes.
Well, I'm happy to talk about this because it is huge. Another thing that you're looking at, especially when you're looking at Part D, your drug plan, is to see if you can find one of the plans that has the insulin for $35 a month. Now that might go up in 2022, but in 2021 the number is $35, and if it does go up, it will be a small increase. Medicare realizes how important it is that folks that need insulin get it at a price that they can afford. And they were seeing skyrocketing prices, and they responded to what beneficiaries needed. I'm extremely proud for them of that and happy that they did that.
And that can save them a lot of money, which shows that they are actually listening to the individuals that are out there. What are their needs? What are their concerns? And what can't they afford?
Exactly.
We've all heard about the insulin prices skyrocketing, but also what's important, we keep coming back to this, is your SHIP counselors. They can help you. Don't be shy. They want to hear from you. They'll answer any question you have. They'll assist you in any way they can. If they don't have the answers, they'll get it. We got more information coming up in just a couple minutes. Stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about Medicare. We're covering a lot of individual little topics you might not have known about. And Kimmy, one is what's called helping programs. And you're eligible throughout the year for these programs. So your eligibility can change during the year. Maybe your costs are surprising you. What are the helping programs?
Well, you know, I think the bottom line is that the helping programs provide options for people.
Yeah.
That may not have options to begin with. So, you know, and I always say, this is a hand up, not a handout.
Right.
And it's very, very clear that these programs that help Medicare beneficiaries are really, really good, and I love to promote them. The first one that I want to talk about is called the MSP, or Medicare Savings Program. Mm-hmm. And that is a program that is attached to Part B of your Medicare. And remember, that's your outpatient.
Yes.
What MSP does is pays a premium for your Part B, and in 2021, the premium for Part B is $148.50. Now that's not a fortune.
Yeah.
However, it might be to you.
It adds up.
It does. And under the MSP program, you get to not pay that $148.50.
Yeah.
MSP will pay that for you. And I think for people on these really low fixed incomes, imagine what an extra $150 would mean in your budget. It would mean everything. The other thing that MSP does is, in terms of what it will pay for, it also pays for the deductible for Part B, and for some people it will pay for some out-of-pocket costs. Mm-hmm. But if you want to find out if you're eligible, call a SHIP counselor. Yes. I mean, even if you think, oh no, I'm never eligible for anything, give a call, because you just might be.
Yeah.
And within the MSP program, as I said, there are options. Not every single level is the same. So you may make a little more, but still be eligible. You need to check it out.
Right. Uh-huh.
Now, the other really huge helping program we want to talk about is the low-income subsidy, or the plan that helps pay for Part D, your drugs.
Yeah.
And the reason that that's so important is that many folks take many drugs as they age, and to have a helping program to help pay the deductible, the out-of-pocket expenses. It may pay for whatever you're paying as a premium at the counter to pick up your meds. The low-income subsidy, or extra help, is also referred to, is really a wonderful program to go along with Part D. And that, again, I want to say, please, don't just think you're not eligible. You very well might be. So call a SHIP counselor to find out. Now, I also want to talk about another really wonderful helping program called Big Sky RX. And Big Sky RX is, we're proud of it. It's a homegrown, homemade program that's been around for years, helping people pay for their Medicare Part D, the drug piece of their Medicare. And the thing that's so nice about Big Sky RX is that it's for people who make a little bit more money than maybe the folks that would be eligible for the other programs that I'm talking about. And it also doesn't take any kind of assets into consideration. So if you have 15 cars and 10 houses, it doesn't matter. This program is based on the kind, in Montana we have a lot of land-rich, cash-poor kinds of situations, and Big Sky RX can help with that. Those folks making slightly more that usually don't get eligibility can get a premium up to a certain amount that is set by Big Sky RX each year to pay for their Part D. So they don't have to pay that Part D premium each month, and it only covers that, but that's a lot.
Oh, yeah,
because remember I said that they're about $30 average per month. Again, another $30 in your bank account could pay for
your insulin.
Yes, exactly.
Yes.
Exactly. And let's talk about that again, because I think it's so important. The way that you're getting that good deal on the insulin is to, again, do your homework and look at the different plans under Part D that have that $35 insulin, and then just look at your other meds.
Yeah.
Are your other meds also covered by that plan? And would that fit for you? So the help out there is really good, and we just really encourage people not to think that it's some kind of handout, because it isn't. They've worked so hard for so many years. They've supported families and community. This is the least we can do.
Exactly. And quickly, in about a minute, there's a website out there, Medicare.com versus Medicare.gov.
Yeah.
What's the difference?
Well, just remember that .gov is it's coming from a governmental institution or program, and .com is a business. So it isn't that it's shady, but Medicare.com is probably trying to sell you something. And again, that's okay, because that's the way it goes. But remember that you're not getting that objective information necessarily. You're getting what that website wants to sell you.
What they want to sell you. Well, Kimmy, thank you so much for being back on your show.
Sure. I love talking about Medicare.
Yes, it's great information. And for our viewers, we covered a lot of ground today, but bottom line, there's people out there in your community throughout the state, SHIP counselors. They want to hear from you. They want to answer your questions. If you're scratching your head saying, God, I don't know what to do, where to turn, that number on the screen, they can help you. But they can also help you with other programs that are offered through your area agencies on aging throughout the state that can help you make ends meet. Thanks for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.